This video is about reproductive health care in the United States. First, we'll talk about what reproductive health is, what you can expect in the United States, and who to contact if you have more questions. What is reproductive health? Reproductive health care includes care for your mind and body as it relates to human reproduction. Often, reproductive health is associated with care for women. For example, regular gynecological care is a woman's doctor, and obstetric care when women are preparing to have a baby. Reproductive health care is also provided to men and cares for their reproductive systems. This includes, but is not limited to, preventative care, maternal and paternal health, pregnancy, infertility, abortion, maternal and newborn care during and after birth, contraception, family planning, etc. What can you expect in the United States? You can talk to your primary healthcare provider if you have questions or concerns about your reproductive health and to access preventative care. Preventative care is important because it stops sickness before it starts. Reproductive health care makes sure that your reproductive system is healthy, both for women and men. Family planning helps teach you what you can do to avoid pregnancy if you do not want to have a baby or if you want to take some time between babies. Pregnancy care, that helps keep you and your unborn baby healthy. An annual checkup is recommended for everyone, and everyone should see their primary care provider and or gynecologist at least once a year. The gynecologist specializes in women's health. What happens at an annual or well-woman exam for women? Usually the doctor will talk to you about any new concerns and update your list of immunizations or medication. They'll update the medications that you're currently taking and decide if you need refills for that medication. Depending on your age, the doctor will do a pelvic exam and a breast exam with which both check for illnesses like cancer. The pap smear, which is usually every 3 years, checks for cervical cancer, and the doctor will walk you through all of the steps in the process. Mammograms are for women aged 45 to 54 years, and usually mammograms happen every year. And then once a person turns 55 years old, the mammogram happens every 2 years. However, if you have a history of breast cancer in your family, you can get a mammogram earlier on. Your doctor will also measure your height, weight, blood pressure, and listen to your lungs and heart, and check anything that you might have questions about, and then tell you about any other health tests that you need. And you can always ask for more care if there's something that you're worried about. Pregnancy care is really important, and it's important to go to the doctor in every appointment when you are pregnant. This way, the doctor and nurses can make sure you and your baby or babies are okay. At Parkland, which is where many refugees go to get care in the Dallas area, you will meet with a financial counselor a week before your first appointment to apply for Medicaid if needed and to make sure that everything is set financially. There are 10 clinics where you can go to see the doctor, and you can find the clinics at www.parklandhospital.com/women's-health-locations. You can also just Google for the Parkland Health Clinics and the list will come up. Appointments are usually every 4 to 6 weeks early in the pregnancy, and then every 1 to 2 weeks near the end of the pregnancy, or more frequently if necessary. Doctors also recommend a well-woman exam the first year, and then every 3 years after the birth, which is what I described in the previous slide. Patients who go to Parkland are encouraged to deliver at Parkland, but of course, you should deliver where you're most comfortable. You can also decline tests if you do not want them, and everything is confidential. You can and should ask questions if you want more information. If you have more questions, you can contact your caseworker or you can call the nearest Parkland Women's Health Center at the same link that I described before. And you can also contact the Vickery Women's Health Center, which is where a lot of refugees go to get care. The phone number is 214-266-0266, and the location is at 8224 Park Lane, Suite 130.